I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and IntellectAbility. For more information, go down into the show notes and click the link where it says Learn More Here.
Hello, and welcome to this episode of IDD Health Matters. Our guest today is Cody Clark. He is a magician, right?
Yep, a magician and an autistic self-advocate from Louisville, Kentucky.
Wonderful, Cody. Welcome to the show. Tell us, how did you get started in magic?
Well, when I was 11 years old, our family went on a vacation to Gulf Shores, Alabama, which I like to joke is where families go when they can't afford Florida. That is when our family went to a magic show, and of course I like theater and stuff already, so I was already drawn to it. But it was when the magician called me up on stage and let me help him with a few tricks, including the infamous sawing a lady in half trick.
Wow.
That was quite a first trick to do, right?
Yeah, that's impressive.
Thankfully, she didn't stay in two pieces for too long.
Very good.
But that moment where he directly empowered me and showed me magic wasn't just something you were born with or something that was impossible to learn, but it made me feel there was something I could do. Because when you grow up autistic, you're so used to either being told you can't do or trying things, and because of motor skills and comprehension differences, it being genuinely harder for you to do a lot of things. So I tried like sports, I tried music, I tried other things. It wasn't until magic that I found an art form that really took to my natural talents that made me feel I could do things.
That's excellent. And, you know, that speaks to all of us. Sometimes we find our place. We find what we enjoy, what our passion is, and what we like to do and what we do well. And it sounds like you found yours in magic.
Yeah, it's a lifelong journey, but as soon as I got into magic, everything else started clicking because, of course, it utilized my interest in the dramatic arts, but also my interest in entrepreneurship and my interest in advocacy that developed as I became okay being public about my autism.
Now, I understand that you use magic tricks really to send a message or tell a message to your audience, right?
More often than not. Of course, there are times I do just for fun magic shows, but one big part of business is targeted marketing, finding a group of people who need you in particular and aren't being served as much as they need to be for that particular need. And it was when I became okay mentioning my own autism, and that was thanks to a magic mentor named Richard Bufo, who was like, write one routine about it, see how the audience reacts. And then I saw that I was thinking I would be booed off stage, but the total opposite happened, is that everyone thought I was vulnerable, and everyone was like, oh, I can relate. I have a relative with autism, or I'm suspecting I'm autistic. And that is when I was like, oh, I may be able to help my community here. I may be able to take the lessons I've learned from learning to be okay with my own autistic identity and being okay with letting other people know I was autistic, that I could take those lessons, combine them with magic tricks, and in some contexts combine them with talks and be able to serve the education community and the autism community, the disabilities community itself. And it actually never ends how many different places want to learn about autism.
So that's probably taken you to many places to perform. So what are some of the places that you performed? What are some of the settings?
Well, we're both here at the AUCD conference in Washington, D.C., Association for University Centers on Disabilities. And this is essentially a meeting of college disability departments. That is a big market of mine because from their funding, I'll usually do a magic show for the whole campus. And that is my Autism Advocacy Magic Show, A Different Way of Thinking. Nice. That one is like a magic musical in that it doesn't feel like a talk, but the scripting is so interwoven that it has the effect of a talk, but it feels like entertainment. And then I'll do talks for what they call pre-ETS, pre-employment transition services.
Okay.
And that's for like high school juniors and seniors, people in college. And a lot of your college disability departments nowadays have post-grad services to help you find a job. So the shows will usually be for the entire campus. The talks will usually be concentrated for just the students using the disability services. And then later this week, I'll be in Chicago for APCA, which is the campus activity side of things. And
Nice.
that is educating the rest of the campus about the disability experience, plus talks on more generalized things like emotional resilience.
So it takes you all over the country, right?
Yep, all over the country, and I've been to Canada twice, and
Nice.
Europe's on my bucket list.
All right. So you hear that? Anybody out there looking for a magician in Europe?
A magician or disability advocate in Europe, I would love to go.
Sounds great. So you also use your skills to talk to clinicians sometimes, right, about people with autism and help them understand maybe how to provide care for people with autism. Can you talk about some of your own experiences with healthcare?
I would be happy to, since some of my earliest memories, I didn't know specifically the word autism applied to me until 4th grade, but of course I knew there was something different, that me being taken out of class during that random Lincoln Log hour for therapy was not normal. And I knew that it impacted how I went to the pediatrician, how I went to the dentist, and even to my hair cutter.
Okay.
It helped that I had parents who chose all 3 providers there based on how autism friendly they were, and that was before a business could be certified autism friendly. That was in the early 2000s where that was really a rarity and on a individual by individual basis. But I do remember all 3 of them explained their procedures well before they did it, and that is a helpful disability-friendly accommodation that essentially with autism, one part of it is that you're not born with the same social skill script everyone else is born with. Mm-hmm. We have to learn it by hand. So a doctor having what's called a social story of what's going to happen in that particular session often helps out a lot. Granted, I know depending on the diagnosis that happens at the meeting, it's not always predictable, but enough of it is. And he could even mention this will vary based on the results. And here's what could happen depending on if you just need medicine, here's this. If you need surgery, here's this.
So for the clinician, the advice would be to very clearly explain what is going to happen, what you expect to happen, what are the potential outcomes and the potential different options for treatment?
Yeah.
Is that something that's helpful?
Yeah, that, and to be honest in advance about what's not predictable.
Okay. That's actually great advice. What you mentioned your hairdresser. That was
Yes.
Tell us about that. Yeah.
Well, I actually still go to him. His name is Larry, and he's on one of the big stretches in my end of town in Louisville called Dixie Highway. That's like the main street of the south end of Louisville. He's a big legend in haircutting. He's one of those who's probably been in business about 50 years. But I think my mom started going to him because he was at least initially willing to have me come in during off hours.
Okay.
And I know that's not always possible, but a lot of times in like your pediatric practices or your dentistry offices, you can have someone come in the hour before you open to everyone else or the hour after. And that way you can crisis manage in a worst case scenario, but in a best case scenario, it's just me and the practitioner.
Okay. And was it difficult, your first few haircuts that you remember? Was it tough for you?
I think it was until I learned firsthand haircutting was not painful.
Gotcha.
Because I think that's common with a lot of kids, autistic or not, that, well, of course, it looks like it's going to be painful, and there's scary movies about it being painful.
Sure, and you see these sharp things coming at you, and you can't really see what's happening. You don't really know what's going on, yeah.
But I think him and I remember my pediatrician, they both also had a good sense of humor to help with everything else.
Great.
Like Larry would joke about my first crushes and all that. And actually, Larry still does, to be frank.
Well, Larry does a good job on your hair. You've got great hair. So.
Oh, thank you.
So what other tips do you have for healthcare providers who are treating people with autism?
Well, I got some note cards for the talk I'm going to give at APCA on sensory-friendly campus events, and I'll highlight the parts I think will be relevant to practitioners too.
Great.
There's some don'ts and do's in terms of the sensory environment.
Okay.
Essentially, with autism, it's a different neurology, so the wiring is different, and that's why sights and sounds everyone else is fine with can cause us a lot of pain. The big don'ts are excessively loud noises.
Okay.
Which pediatricians' offices are overall good there. Dentistry offices may have a few more problems. And haircutting, it really just depends on the rest of the environment.
Yeah, some of the noises we hear in dental offices don't sit well with any of us. When you hear that drill going in the background, it makes all of us upset sometimes.
So it reduce as much as you can, like have softer music if you do play music in the office, and pre-warn about noises that you can't really reduce, like dentistry especially, that all these machines, we can't help it, but you can get used to it, prepping in advance for that. And then bright lights, like find ways to reduce the fluorescent lights of most offices. There are screens and filters you can put on them to at least reduce them a little bit. And you're probably getting the hint that sudden surprises can often be startling to people who are neurodivergent.
Sure.
That we prefer being pre-warned a little bit about things in advance. And the big to-dos, calming, soothing audio, and things which are very visual, like if someone's really panicking about being at the appointment, things that are calming, soothing, and visual could potentially be played at the same time. And I've seen a lot of your new gen barbers and dentists straight up have TVs attached to the chairs. So that could be, even if it's just one TV, you could have that rolled in. And a lot of us have special interest in particular TV shows. That could be a strategy. And you could even, noise canceling headphones are an easy tool, or headphones that could connect directly to the TV so that the particular patient is the only one hearing their comfort show. And the comfort show is helping them get through everything else you have to do.
That makes sense. What about smells and the way things smell? Does that affect people with autism differently?
Some more than others. A lot of our sensory triggers will be different, but indeed, textures of certain foods can affect us, and then smells, that we can smell things more intensely too, usually.
Okay, because I noticed, at this conference, one of the rules that they had or recommendations was that no one use any type of cologne or aromas, because some people are more affected by those than others.
Oh yes, I noticed that too.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of IntellectAbility. State developmental disability agencies, managed care organizations, and providers across the United States use IntellectAbility's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. So, I want to get to a magic trick in a minute, but before we do that, I always ask guests to tell us three things, 3 tips, 3 words of wisdom, and you've already given us some for sure, but things that you would like the audience to know, say for instance about people with autism, particularly related to health, if you can relate it to that we all should be aware of, that can make the world a better place for everyone.
Well, first is one thing a lot of people don't realize about people who are autistic or neurodivergent is we can often have weaknesses in what's called interoception, the ability to be aware of pain that you're experiencing or that a medical issue you're having is actually not normal. So you may need to do a bit more digging with your neurodiverse patients because a lot of us don't realize something's wrong when really something is very wrong. Like
that is very fascinating and a great tip.
Because a lot of us can forget to drink, and then there's some, not me personally, but there's some who can walk around with like cuts or wounds all day and not think any different.
Wow.
And then you all can imagine how the worst case scenarios of that too.
Sure.
So that is very important to know about in advance. And a lot of us who are having trouble eating what's called healthy foods, even though they are healthy, a lot of it is texture sensitivity issues.
Okay.
Where broccoli, I still have a hard time with. Mushrooms, I still have a hard time with. Whereas your processed foods are the same texture every time.
So being aware of maybe a reason a person is not eating something that's healthy or good for them is because of the texture, not necessarily they just don't want to eat it.
Exactly.
Okay.
It's not a moral thing, it's a texture thing.
Gotcha.
Once you realize that, you can find workarounds or like really scavenge the grocery store for fruits and vegetables with the right sets of textures.
That makes sense.
And the big thing is to assume competence, not ignorance.
Couldn't agree with you more there for sure.
That is something that is often overlooked. People who have good intentions will often talk in baby talk to people who are adults who are autistic or neurodivergent, and that actually harms more than helps.
Those are excellent, excellent words of wisdom, words of advice for everyone. Now let's get to some magic. How about that? So this is we have a video version on YouTube for those of you that are listening on audio. So if you want to see the tricks, check out the YouTube version for IDD Health Matters podcast as well. But Cody, I'm going to turn it over to you to dazzle us.
Well, I've got two today, if that's okay.
Excellent.
The first one is also a radio-friendly one.
Okay, great.
That way, of course, I do hope you watch the video feed so you can see how good we both look in our suits this morning.
That's right.
But if you can only listen on a podcast because you're driving or something, this one will still be a good one for you.
Great.
This magic, Craig, is all about the imagination. Therefore, I want you to imagine 4 dice.
4 dice, okay?
The only difference between them, one's colored red, one's colored green, one's colored blue, one's colored yellow.
Okay.
I want you to hand me 2 of them. Which 2?
I handed you the green one and the blue one.
I'll toss those. You have red and yellow, I take it.
Red and yellow's left.
Hand me either of them.
Okay.
Which one is this one?
That's the yellow one I handed you.
You kept red
I kept the red one.
because you were attracted to red. And the law of attraction states that what you focus on the most will come to you, and the rest by the wayside. Listen.
I hear those. Those are dice.
In
The
here,
bag.
I've got some dice, and we will see. This one used to be the green one, but now it's clear with no color.
Uh-huh.
This one used to be the yellow one. Now it's clear with no color. This one used to be the blue one. Now it's clear with no color. The only one, Craig, that kept its color is the red die.
Well, how about that? You knew which one I was going to pick.
Yes, exactly. That's the magic of using our imaginations.
Excellent. Excellent.
Magic by nature is a pretty collaborative thing, and it shows us that our trials are as much a part of our life as our successes, and it's a good reason to have a toast.
Excellent. All right. Let's test.
Cheers, everyone. And you may need to hold the mic right.
Oh, sure.
Because life has given me many opportunities, like the opportunity to be on this podcast. And I've got a red handkerchief right now, by the way. But life has also given me many challenges, many trials, many what we call knots. One red knot in the handkerchief, but fear not, because if you see your knots as opportunities, they fall right off.
Wow. Great job.
Thank you, Craig.
Yes. Cody, thank you so much for sharing your insights with us.
Anytime.
And we hope that you get to watch the video version of this, and we look forward to seeing your show somewhere down the road. How can people get in touch with you if they want to acquire your services?
CodyClarkMagic.com is my main website. It has all the pages for the different types of shows I do, one for the disability advocacy services, one for corporate, and one for my school assemblies. And then at Cody Clark Magic is all my social medias.
Excellent, excellent. Thanks so much, Cody, for the incredible work that you do.
And you too, Craig.
Appreciate it.